Hello again. In today's video, I'm Dr. Brad Wolf, and in today's video, we're going to be talking about, again, the low back. We talked in the last video about what happens to the low back when the low back goes awry, so to speak. And so I wanted to bring the perspective back to what it is that we're really looking for, because we looked yesterday at the degenerative phases of the spine, and you can go back and look at that if you haven't watched that. It's very important to understand what can happen to the body. And these problems are progressive, meaning from the time we're born until now, the total accumulative effect of life and gravity and our posture and accidents and injuries and things that happen to us can change the way that our body reacts to life. And there is a gradual deterioration that happens to the body if we let it happen. But what I want to show you today is what a healthy, normal spine looks like. And also give you some examples of some x-rays. We went through some x-rays and MRIs yesterday. And I want to show you some other views from a different perspective here that you can understand. And again, this is not an age-related issue. In fact, the x-rays I'm going to show you today range from 30 years old to 58, almost 60 years old, 30 to 58. So let's go ahead and get started here. This first thing that we're going to do, I'm going to turn the phone around. Give me a moment here. Okay. So this is a model, and I have the screen covered up for HIPAA reasons, cover up people's names, make sure that I'm not violating any confidentiality as far as images and all that sort of stuff. I want to use this for educational purposes, and I want you to understand exactly what you need, what is good to be able to look at. So this is a model of the lower back. There are 5 bones in the lower back. 1, 2, 3, 4, and 5. And below the 5 bones in the lower back, there's this bone here, which is called the sacrum. In fact, the tailbone sits all the way at the bottom. It's a little bit twisted here. And notice how straight up and down the spine is. Now, there's a term that I first heard from Pilates, which is neutral pelvis. So neutral pelvis puts the spine into a more balanced position, and we want a gradual curve to the body so that we absorb the stress of gravity and the stress on our spine and whatnot. Now, when we look at the spine, I want you to notice in here, 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 here. That's where the nerve exits the spine. And when the spine gets collapsed in some way, we started seeing degenerative changes of the spine in the last video. This is what we're going to compare to. We are always going to compare to what the ideal is. Even if we can't completely meet that ideal, we want to be as close to it as possible. So we're going to go ahead, and I'm going to go ahead and move this out of the way here. And we're going to go ahead and get to work here. So I've pulled up a handful of x-rays here, and we're going to go ahead and get started. Okay. So I'm going to give you the ages of these people too. But this is a 45-year-old person. And again, I don't remember male or female. But notice how there's a nice curve in the spine here, okay? Now, you can not only have a curve, you can actually have too much curve. Now, she's got a decent curve. She's got some other issues in the spine. But, you can see where maybe there's a little bit of wear in between this one here. These two look a little bit better. But she's 45. And in the last video, we were talking about the L5 disc, which is right here. She looks actually pretty good, and she's not really having any, at least any pain in her lower back, but it doesn't mean we still don't want to pay attention to what's going on in the body, because even though a problem maybe is not there today, it can accumulate over time, and maybe tomorrow or next week or next month or next year, you can end up developing a problem over time if you're not paying attention to what's going on. So Again, these are relatively normal, not completely 100%. Again, it's very rare you're going to find somebody who has a perfect spine. It happens on occasion. I've seen a few of them in my life, but that's what goes on. Now, this is a 31-year-old, and we had spoken in another video about what we call flat back syndrome, and this is a great example of that. But when we look at that L5 disc, the L5 disc has a little bit of narrowing in there, but she's still got a decent amount of space there. And she's also 31. So again, time is a factor here because the stress on the spine is cumulative. But notice how straight that spine is. She has a very clear case of flat back syndrome. And over the course of her life, unfortunately, some of this was developmental, some was probably genetic, and she may have, develop a significant amount of pain as she gets older because she doesn't have a curve. Remember, we want that curve in there. We want that curve in there to be able to protect the body over time. And when somebody comes in to see me who's 30, 31, I see people even in their early 20s who have problems and they have chronic back pain. So this is the third one here, and it's turned around, so don't get confused by it. But same idea here, that the spacing in the spine, this is a 38-year-old person. Now I want you to notice there's pretty even degeneration throughout the entire spine, but it's pretty even. And that L5 disc doesn't look, it's definitely not ideal, but it's not like some of the other ones that we saw yesterday when we were looking at that. But this is a person who is 38 and came in and has low back pain. We can start to see what happens, and sometimes the positioning looks good, meaning that the curve in the spine, I'm not going to do it justice here, but the curve in the spine looks pretty decent, not ideal. We want to get the base of the spine, which is the bottom of the spine down here, down, dropped lower. Remember we looked at the model where the base of the sacrum, this bone down here, and the tailbone should be pointing down as opposed to more horizontal. So let's keep moving on here. So here's the next one here. Okay, look at that curve. That's a nice looking curve. And we have this bone here, this sacrum is sitting almost horizontal. So you can have a curve in the spine, but you're tilting your pelvis way far forward. And this idea of neutral pelvis, it's not happening. So the space is right in here is where that nerve comes out, where I was showing you in the model. And so again, we start compressing in the lower back, even just if positionally we're not in the best place. The tailbone is actually pointing down in this particular position, but the sacrum is completely in the wrong position. So positioning matters. And oftentimes when we get x-rays, I'll get x-ray reports back from the radiologist that says, this is a normal lumbar spine. And I look at this and I go, no, this is not a normal lumbar spine. In fact, radiologists are really only looking at three primary things. Now, they may be looking at more than that, but three primary things: fractures, right? Broken bones, tumors, and signs of degeneration. And if they don't see that, a lot of times they'll say it's a normal spine. Well, I'll tell you from my experience, clinical experience, this is not a normal spine, even though it's got a really nice curve and we've got decent spacing between the bones. We do have some narrowing in some spots, but again, this is a 39-year-old. We're going to keep going here. Okay, this is a 52-year-old. Again, we've got some flat back syndrome going on, right? Very straight in through here. That L5 disc, we've got some space in there. It's a little hard to see because of the contrast of the X-ray here. And so again, there's going to be more, and look how horizontal that sacrum is. Let's see if we can kind of zoom out there. It's right there. That bone there is sitting almost horizontal. That person is going to have some extreme pain, likely, okay? But especially with the flat back syndrome, you're going to have a tendency to put more compression on that lower back. Remember, low back disability is #1 cause of disabilities in the world, in the world. Let's keep going here. Okay, again, semi-decent curve here. I tried to pull out the ones that were more normal than not. Not that they're completely normal, but or healthy, but they are better than the other ones. And again, if you don't get an X-ray, you cannot know this. You can't see this from the outside. You can maybe have a clue that there's something going on, but to get an X-ray makes a big difference. Again, that sacrum is sitting. We'd like to see that sacrum get a little bit lower here, a little bit lower, a little bit less arc in the lower back. That's going to put more compression on the lower back. This is a 58-year-old. Okay, so again, we looked at a 31-year-old and now we're looking at a 58-year-old. This person here has had low back issues, which is part of the reason why we got the X-rays on it, but there's a nice curve there. The sacrum, again, that bone here, this is a very common experience. This bone here, we want to bring that bone down so that there's a more natural curve and it's not putting so much compression on this lower back right here. Okay, we keep moving on here. That was a 58-year-old. We got 2 more here. Okay, this is a 36-year-old. Again, you'll see this is not age dependent. Again, another flat back syndrome. Look how horizontal that sacrum is. Look at that. Look at that. We want to get that way, way down here. We want this to point downward, and it's pointing horizontal. But what happens is it goes this way, and then it goes up that way there. And the acuteness of that angle, meaning how sharp that angle, there's no curve there. It's just very straight all the way through there. And that's going to start to cause problems. Last one here. Okay, we've got a little bit of a curve. The sacrum is sitting pretty low. I'd like to see it get a little bit lower there. Again, we start to see some narrowing in between that L5 disc. Look at the difference between this one here and the one right above it. Okay, we start to see some narrowing in between there. That matters. We want to have a nice even curve. In fact, according to, I'm trying to remember what the doctor's name was, but they say that the curve should be it should be 60 degrees. We should have a 60-degree arc here, both in the lower back, the mid back, and the neck. And so over the course of our life, if we're not paying attention, this can start getting away from us. And this last person was a 37-year-old. So remember, age does not have anything to do with it. Certainly sometimes when there's more time that passes and a person is older, maybe we'll see more degenerative changes. But remember, we want to come back to what is that ideal spine supposed to look like? We get that sacrum nice and pointed downward, right? This is sitting nice and low with a nice gradual curve. And the spaces between the bones, the discs, are well preserved over time, because the more those discs start to disintegrate, it starts to put pressure on that nerve. It closes in on the space where that nerve is, or if the disc starts to swell and it puts pressure against that nerve, that's going to be really problematic. So again, this is a look at really looking at a healthier spines, but also some other things that can happen with the body that can become problematic in your life. Again, these things oftentimes don't happen. They don't happen so quickly. They happen gradually over the course of many months and years. It's essential for you to get X-rays on your spine, just like you get X-rays on your teeth, to make sure that you can care for yourself. Get a good chiropractor, get somebody who can evaluate you and look at you from a holistic wellness perspective, as opposed to waiting until the body breaks down. I'm Dr. Brad Wolf. We've been talking about the lumbar spine, and I'm here for you. If you have questions, leave questions in the comment section below, and we look forward to talking to you soon. Have a great day.